Chronic neck pain rarely disappears after a few days of rest. Data from global burden studies show that people who develop persistent neck pain live with that disability for an average of 22 years. The economic toll is significant. Within the first year of diagnosis, non-surgical care for neck pain accounts for roughly $346 million in healthcare expenditures. Across the workforce, health-related absenteeism linked to this specific pain affects up to 27% of employees in some regions. To treat this, the medical community relies heavily on a standard combined prescription, manual therapy paired with exercise. This involves a healthcare provider physically manipulating and mobilizing the joints and soft tissues of the neck, while the patient puts in targeted physical effort through stretching, strengthening, and motor control routines. Researchers recently gathered data from hundreds of patients across multiple international trials to break this go-to treatment down. They wanted to measure exactly how much of the healing comes from the actual physical intervention. When we separate the components of our most common physical therapies, we need to know if the relief comes from repairing the body's mechanics or if a hidden psychological mechanism is actually doing the heavy lifting. The researchers started by testing the combined therapy against a baseline of absolute zero, a control group that remained on a wait list and received no treatment at all. This chart compares the untreated group to those receiving the therapy. The active treatment group experienced a 24% reduction in pain. Looking next to the pain data, patients also reported a 14% increase in their daily physical function. Compared to sitting on a waiting list, actively manipulating the neck and completing targeted exercises works effectively to get patients moving again. Doing something is clearly better than doing nothing, but this test fails to isolate exactly why the patients feel better. To find out if the hands-on mechanics are the true source of relief, scientists had to introduce a much stricter baseline. They swapped the no treatment control for a placebo. Patients received fake interventions, like a deactivated laser that emitted no energy, or an attention control session without actual therapeutic manipulation. When measured against a placebo, the pain relief we saw earlier almost entirely disappears. The difference between the real therapy and the fake treatment shrinks to less than a single point on a 10-point scale. Why does the pain relief vanish when the control group thinks they are being treated? The answer lies in a phenomenon called inherent trial bias. If you take a mystery pill, you can't tell if it's medicine or a sugar capsule. But physical therapy requires active participation. The patient and the therapist are always completely aware when a real massage or exercise routine is happening. Because the patient knows they are receiving specialized care, their psychological expectation of healing surges. This expectation alone triggers a powerful internal pain relief response in the brain, completely independent of the actual stretching or joint manipulation. The dramatic pain reduction we see in physical therapy is heavily driven by the mind's contextual expectation of receiving care, rather than the mechanical movement of muscles and joints. But the physical mechanics aren't entirely useless. While the pain relief equalizes with a fake treatment, a patient's physical function actually improves. The data shows a 10% advantage in real mobility over the placebo group. The physical work also carries low risks. Patients face only a 2% chance of experiencing minor side effects like temporary dizziness or treatment-related soreness. Researchers classify this as low-certainty evidence, but that does not mean the therapy is a waste of time. It simply means the placebo effect is doing heavy lifting right alongside the actual mechanical improvements to the neck. If a patient has the funding and the schedule to attend 2 to 3 sessions a week, combining manual therapy with exercise is highly recommended over resting and waiting for the pain to pass. Physical rehabilitation operates as a multimodal process. It relies on hands-on care, active physical effort, and the brain's powerful expectation, all working in tandem. Healing a chronic injury involves assembling a complex structure where the mind's belief in the treatment is a critical load-bearing pillar alongside the physical work.